Okay, so now we look at the effect of smoking to the respiratory system. For example, in this case, it is lung cancer. Okay, so what happens when a person smokes is that when the smoke is inhaled, okay, the toxic substances in the smoke will paralyze the cilia lining in the trachea and bronchi, preventing removal of inhaled particles. So you've learned uh, in your immune system, okay, and also in uh, epithelial cells. So the lining of the trachea and the bronchi, we have cilia, which help to remove harmful pathogens, okay, from the airway. But when we have this toxic, this will paralyze. Therefore, our lungs or our trachea and bronchi cannot remove these particles. Okay. In addition to that, tobacco cigarette smoke consists of microscopic carbon particles bearing dozens of cancer-causing substances, which leads to lung cancer. Okay, so this increases the chances of having lung cancer. How many? By about 15 to 30 times more likely to get lung cancer or die from lung cancer than those who do not smoke. So this is how much increased risk of smokers. Okay, so we look at the chemicals. So nicotine, why is nicotine? Is the addictive substances in tobacco. So when it reaches the brain, it creates a dependency so that smokers become addicted, in which they have difficulty in stopping or stopping to become smokers. Okay, so and then you have tar, which is a toxic chemical that is left by the burning tobacco. Okay, so these substances form a tacky brown or yellow residue in the lungs. Yeah? So this will paralyze the cilia in the lungs and contribute to lung disease such as emphysema, chronic bronchitis, and lung cancer. And then you have several chemicals or substances that can cause cancer, such as cadmium, arsenic, and aromatic amines, etc. So these are the lists that you can read through yourself on what are the cancer-causing agents. We have several types, okay, from benzoyl, beta, naphthalene, cadmium, etc. Alright, so this is the what contained in the cigarette smoke. Okay, so lung cancer, sometimes known as lung carcinoma, is characterized by uncontrolled cell growth of the tissues of the lungs. So when the cancer grows in the airway, it can obstruct the airflow, thus the person has difficulty in breathing. Okay, and besides that, the obstruction can lead to accumulation of secretion behind the blockage. Okay, so tumors in the top of the lung may invade local part of the sympathetic nervous system, leading to dropping of the eyelid. Okay, so what are the treatment? So first is surgery, which is to remove all or as much as possible of the tumor. And we have another one, which is chemotherapy, which is intravenous medicine to kill the cancer cells. And sometimes we use radiotherapy, which is high dose of radiation designed to kill the cancer, given in a focused and shielded beam to affect only the tumor. So these are the bad effect of smoking, which is lung cancer. Okay, so this is the differences in the normal lungs versus the lung that is smokers, when you smoke. Okay, these are the typical chemicals that are inside a cigarette. Okay, from ammonia, nicotine, toluene, hexylamine, citric acid, butane, and all that. Okay, and then this is you call chemotherapy. Okay, so when a lung cell become cancerous, they will become damaged, they become uncontrolled division, using chemotherapy drugs to kill off the cancerous cells. So only the healthy cell remains. Okay, so you can read through yourself on effects of smoking, okay, towards the lungs.